So does laser eye surgery cause dry eyes? Absolutely, it does temporarily. And we know the mechanism. So the laser eye surgery interrupts the nerves in the front of the cornea. Now that corneal sensation is critical to creating a feedback loop that generates tear production. So when you reduce corneal sensation, you decrease tear production, and yes, the eyes will become more dry. Interestingly, early on after laser eye surgery, patients will feel quite comfortable because the eye's a bit numb, but it'll affect the quality of vision if the eye's a bit dry. So they'll blink and feel, oh wow, my vision's amazing, and then it will destabilise because the eye's a little bit dry. So we work the patient through that because it's a temporary effect. The nerves grow back in, and we know that. And with LASIK laser eye surgery, it takes 6 months for the nerves to grow back in, the sensation to come back to normal, and the tear production to come back to where it was. If that patient was a contact lens wearer, there will be a win from them not wearing contact lenses anymore. Contact lenses cause dry eye. And so by getting these people out of contact lenses, they can look forward to an improvement in tear film and reduction in dry eye symptoms because they're no longer wearing contact lenses. SMILE laser eye surgery, the keyhole laser eye surgery, results in a more rapid recovery of dry eye symptoms. So for these patients, typically it's only about 3 months before they get back to normal. So really with laser eye surgery, it's a short-term manageable problem. Onto it straight away, we know it's coming, and so we carefully assess patients after treatment. Some patients will use little silicone plugs in their tear drainage, just like putting a plug in a bath, holding up the moisture that they make themselves and which they're adding in the form of topical lubricants, which we also provide for them. The need for lubricants diminishes as the weeks go by. We can almost always take the plugs out after a couple of months. In fact, it's only a minority of patients who need those. Very, very rarely you come across a patient who experiences some longer-term discomfort. And I think this is because we're all different. It's because the nerves have to regenerate in exactly the right pattern, and occasionally that can take longer to settle down. So there might be an individual nerve that's just jangling away and can give people a dry eye sensation even though the eye looks normal. The tear film quality has actually returned to a normal level. We have some medicines we can use to manage that, and invariably it settles down. It just takes a bit longer. We look after people through that, and that's important to make sure that we carry people through until they feel comfortable. Because it isn't one size fits all. It's not everyone bounces back after 3 to 6 months. Almost everyone does, but we're there for the people who don't, and I work with them until I've got them feeling comfortable again. And I've never not succeeded in getting people back to a stage where they do feel comfortable.